Our next speaker is Catherine Berens, and we're looking at neurological conditions and mental health in the Horizon Europe programme. And Catherine is Deputy Head of Unit in Combating Diseases in the People Directorate of the European Commission's Directorate General for Research and Innovation. She's been there since 2021, but she's joined the Commission since 2002 as a trained pharmacist. She's worked in a number of different policy themes across a range of areas, including in relation to rare diseases, access and reimbursement of medicines, neuroscience, and healthy lives. And Catherine is with us today, so that's good to have it in person. Thank you.
Thank you very much, Madam Chair. Thanks a lot also to our guest for having invited me today to present you the brain research that will be conducted under Horizon Europe. I think I don't need to convince this audience that brain disorders are really a major cause of disabilities and a high burden for patients, for families, for the society in general, and that actually we really need research and innovation to provide concrete solutions to answer this burden, and also to provide the evidence for developing better policies. So, despite the progresses that have been made over the last years, there are still a number of challenges that remain and that we will need to address. And you all know that neurological brain disorders are multifactorial, complex disorders. So we really need to foster a collaboration between multiple stakeholders, the researchers, clinicians, patients, industry, payers, regulators. We all need to work together to address these challenges, and there is still room for improving this collaboration. Also, something which is very important is the access to research infrastructures and resources, and also how we see the sustainability of these resources, because it's a known fact that after the funding of a project, it becomes rather complicated to maintain what has been built. So we have scarce resources, and we really need to avoid duplication, and definitely this calls for capitalizing on what already exists, and also to further structure the brain research area by ensuring that all stakeholders work together in an efficient way. And if we want to conduct impact-driven research in order to develop these solutions that are really needed, we need to engage with those who are concerned the most, meaning the patients and the caregivers, because they know what are their primary priorities. And this we need to do over the full process of research, from the conception to the implementation up to the uptake of results. And then something where Europe might be a little bit less efficient at the moment is we are very good at producing excellent research, but we are less good in transforming these results into technologies and products. So there we still need to make an effort in that sense. We don't start from scratch, because brain research has been a priority over a long-standing priority over the years for the European Commission. And here you see the amount of budget that has been allocated to such research under Horizon 2020, the previous framework program. And this funding has spanned the full spectrum of research, from basic understanding of diseases and brain health to the development of diagnostics, treatments, and also more public health related activities. And it is about basic research, translational research, clinical research, so really the full spectrum. We have allocated more than 5 billion euro to brain research, 2,900 projects roughly, and a big chunk for that funding was allocated to collaborative research. We will pursue that under Horizon Europe, the current framework program for research and innovation. And this new program, as you probably know, is very much impact-oriented. And we want our research to have an impact for patients, for the society, for the citizens. And the novelty of the program is that we want to push synergies with other programs. My colleague Marianne already mentioned EU for Health. And like the non-communicable initiative that Marianne explained, our program, Horizon Europe, was developed by co-creating with a number of partners. It started with the public, by public consultations, and also our research and innovation days, where we can exchange with our stakeholders. We also co-created with the member states in order to identify the priority areas where it would make most sense to invest at EU level for research and innovation. And we also co-created together with our colleagues from other Commission services, like DG Santé, obviously. And this in order to make sure that we identify the research which is needed to deliver the evidence that is still missing in order to develop appropriate policies, and in that case, health policies. So Horizon Europe should really lead to a more effective uptake of the research results for better prevention, better diagnostics, better treatment of brain disorders. And I have put here the general structure of our framework program, and I will go a little bit more in details how it will address the challenges that I have mentioned already. So the first pillar, which is about excellent science, will answer the need for more basic research and improved access to research infrastructures. And here, the European Research Council will have a crucial role to play in the bottom-up way that it is organized to fund and support frontier research. And there is quite a lot of research which is going actually to brain research under the ERC. It supports also the career of researchers, like the Marie Sklodowska-Curie fellowships. And under this pillar, we will also find the support to research infrastructures. We have quite good success stories from past funding. The Mosers, for instance, got the Nobel Prize a few years back for their discoveries of the cells that constitute the positioning system in the brain. And actually, both of them received ERC grants and also participated in collaborative research projects, which leads me to the importance of this collaboration between researchers and our collaborative projects that will still be funded under Horizon Europe, under the second pillar. And as I already mentioned, a big chunk of our research funding to brain is via collaborative research, and this is very much needed because of this multifactorial necessity of putting different types of researchers together. I have put here two examples of projects that we have funded under Horizon 2020. One is the remote assessment of disease and relapse in Alzheimer's disease, which focuses on developing a platform that can track changes in the cognitive and functional abilities of Alzheimer's disease patients. And then the second one is more in the mental health field, and it is also developing a platform, but this time to promote well-being and health in the workplace, so really focusing on mental health. I could have mentioned actually projects that are also focusing on mental health in the COVID era, because we rapidly noticed that besides the infection itself, with all the restrictions that all of us were confronted with, there would be mental health issues emerging. So there is also research ongoing to evaluate not only the impact of COVID itself, but also from the restrictions developed at the level of member states, and that to inform in case of a next pandemic. Under Pillar 2, we will have also a number of partnerships funded, and here I would like to mention the Innovative Health Initiative, which has just started its activities. And this new public-private partnership goes beyond its predecessor, the Innovative Medicines Initiative, in that it doesn't only involve the pharmaceutical industry, but also other industrial sectors, industries in the life sciences, such as the medtech, biotech, or digital industries. And in there, you can rapidly grasp that it will be really very relevant for brain research, because it will accelerate the development of innovation across the board in these various areas, from then digital to devices and therapies. And there is really a high potential for funding brain research from the Innovative Health Initiative. On the next slide, I have put a few. Either I don't have, yes. A few topics that we consider relevant for brain research under the first calls for proposals in our program 21-22. So we have the two first, which are more dedicated to mental health. First, a better understanding of the molecular and neurobiological basis of mental health and mental illness. The second one, boosting mental health in Europe in times of changes, very relevant in the current context, I would say. And then you can see very broad types of topics. So there is really a possibility to address these issues in a very open way. So it is really left to the applicants to decide how they would like to address these issues. Artificial intelligence to predict the risk of chronic non-communicable diseases or their progression, solutions for better treatment and care, or chronic inflammation. So it's really our new calls are focusing on impact. And this is really important to understand that it is not business as usual. The applicants have to demonstrate how they will deliver this impact via the research that they propose to conduct. I would also like to mention that the first call from IHI, the draft, because it's not yet officially adopted, includes a topic on improved care pathways for patients suffering from neurodegenerative diseases. So very relevant, I believe, for Alzheimer Europe. Work program 23-24, what to expect? Well, the same, broad topics, very open, with detailing the outcomes expected from the research, and then the applicants have to really describe the trajectories, how they will achieve these outcomes and the expected impact. And this work program will be published towards the end of this year. So we expect IHI, the partnership, to really boost innovation, but we also have the third pillar of Horizon Europe, which is also dedicated to this, Innovative Europe, and mainly the European Innovation Council, which seeks to replicate the success that was achieved via the European Research Council, but in the innovation area. So it's mainly a bottom-up nature, and there will be opportunities for brain research, again. For example, maturing new technologies and then developing a business plan to bring it to the market. I have put there an example of a project financed previously, which is developing a new generation of optical microscope using quantum sensing technologies. And the beauty there will be to be able to have live brain tissue imaging with greater depth and resolution than is currently possible. Improving access and the sustainability of infrastructures and resources is really a very important aspect of the program. And there, I think we need to boost access to excellent infrastructures that already exist, like the one developed by the Human Brain Project, eBrains, which assists with data and with tools in order to facilitate virtual experiments, and which is also providing HPC, so high performance computing, making it available for the brain community. So it is there, and we need to pursue its development and also to allow researchers all over Europe to access this infrastructure in order to develop their research. The Innovative Medicines Initiative also developed quite a number of interesting infrastructures. I have put two there with EMIF that is allowing efficient enrollment of patients, and then we have a resource for induced pluripotent stem cells. So there we really need to make use of what is already out there. You will have heard of the European Health Data Space, for which the proposal has just been tabled by the Commission. I think this is really an important EU priority, which can have a lot of benefits also for the brain and the mental health area, because it will promote a better sharing of data, all sorts of data, those from electronic health records, genomics data, data from patient registries, and making it available, making this data available and accessible in order to develop better health policies, to then also have a better healthcare for patients, and notably to allow further research. So secondary use of data will be made possible via the European Health Data Space, which is currently developing pilots, and the results of these pilots will probably also be very helpful for the brain area. I mentioned already previously that we need to foster the engagement of patients and carers in research. Luckily there, we don't start from scratch either. So we have a number of projects, for instance, Paradigm and EUPATI, which were projects from the IMI, which have trained patients and patient advocates in order to explain how to best participate in research and innovation and how to concretely contribute. I think we can also capitalize on the best practices that already, or the practices that already exist in other areas, like the rare diseases area, where patients are really very active and actively contributing to research. Also noting that digitalization will facilitate, because you have new channels for communication, new modes of research that are being developed. The information circulates much better, so that should empower patients. And our core topics under Horizon Europe in Cluster 1 Health really clearly, explicitly encourage patient involvement, which I think is a really good thing. So it triggers some reflection from the researchers how they can best do it. And I think, okay, we need to train patients and carers and patient advocates, but we also need to teach researchers how they can best reach out and then take your views into account in research. I'd like to finalize by stressing the importance of strengthening collaboration and cooperation at European and global level. So we have a number of initiatives. I will not enter into the details of these. These are all running, public-private partnerships, public-public partnerships, all aligning agendas and then facilitating the work at European and also global level. I think this is a very important way of functioning in order to save resources that we know are scarce everywhere. We do have a coordination and support action which is ongoing, actually coming to an end, and which will be delivering a common research agenda for brain research in Europe. And this will be an important input to put all the existing initiatives together under one single umbrella in order then to facilitate the synergies and to work together and to align these agendas and so that we can deliver ambitious results. So what we have in mind is to have a potential European partnership on brain health under the second part of Horizon Europe, starting from 2025. We need to capitalize on all these existing initiatives in Europe, bringing them together, have clear objectives, ambitious scope, and ambitious goals. Member states need, of course, to really support that, because it is also about fostering a European research area. So it's not only EU funding, it is also national funding. And we will, the start of this partnership is in line with the timing of these ongoing initiatives, and we will start preparing this over the course of the 2 years which are coming. I think this is really good news for the field. And to keep informed, I have put a number of ways there. I would invite you to consult the website, and I guess the slides will be circulated later on. Thanks a lot.
Thank you very much, Canton, for all that information. And as you say, collaboration and cooperation and coordination are really, really important. And I particularly like the emphasis on focusing on patient engagement and their carers. I think that's going to be very, very important in providing solutions and improving well-being.